Hi, welcome back to our 1-minute learning session. This is Nurse Vince. Hi, good day, happy Monday. So, we are on the road actually, and I get time to do our learning session because it's a little traffic. So I said I have to make use of the time that I'm on the road. So naisip ko, and I thought of doing the words related still to DM, because that is my vlog for last weekend about diabetes mellitus, and a sort of a review. I am just doing the words that I could share, and it's easy to remember for you guys. So I am sharing the different words related to DM. So for this week, we are talking about polyuria, polydipsia, polyphagia. I also included hyperglycemia and hypoglycemia, and also we can have Glycosurya as well, right? So we will add 5 new words to your medical vocabulary. Enjoy your week, guys. Keep safe, especially that we're getting back to MSCQ. Please stay at home, right? And please keep safe. And by the way, it's not safe to do a video while driving, especially if you're moving. Just huwag niyong gayahin. It's not safe. I am just doing it especially during red light, right? So take care, and let's learn this week 5 words. Thank you, guys. Hi, welcome back to our 1-minute learning session. This is Nurse Vince, and our word for today is polyuria. So when you say polyuria, as I've mentioned in my past videos, poly is many or more or increase. Uria is related to urination. So that is increase urination. So normally a person is expected to have a urine output, or yung pag-ihi, of 30 cc or 30 ml, 30 to 40 cc or 30 to 40 ml per hour. So that is your normal urine output. So for example, for the whole 24 hours, you should be expected to have a urine output of 40 cc maximum, or more, 40 depending on your intake, 30 to 40 cc per hour times 24 hours. So it's related to, it could be of a lot of factors. So one of it is diabetes mellitus. There. Word is polydipsia. Hi, good day. It's polyuria. So when you say polyuria, as I've mentioned in my past videos, poly is many or more or increase. Uria is related to urination. So that is increase urination. Hi, welcome back to our learning session, and our next word is still related to diabetes, because that is my YouTube video or lesson or topic for this week. Our next word is polydipsia. So like polyuria, polydipsia is increase or excessive, and dipsia is related to thirst. So that is excessive thirst. So when your body is or demanding for a lot of water, or you have that urge to drink, if you have that excessive thirst, then that is polydipsia. That could be related to diabetes when, for example, it's a compensatory mechanism of your body to counteract dehydration, right? When you have a lot of output, right? So that is excessive thirst. Thank you.
Para sa ating HOTD or Hugot of the Day, dahil ang word natin ay Polydipsia, excessive thirst, uhaw na uhaw. Para bang uhaw na uhaw ka sa atensyon ng imaginary mong jowa na inconsistent naman sa buhay mo? Alam mo yung parang Christmas light? Sa bagay, malapit na yung Pasko, on and off, nandyan, tapos wala na naman. Hay nako, charet lang. Bye, Bavarians!
That is Polyphagia. Glycosurya. Our next word is Polydipsia. So like polyuria, polydipsia is increased or excessive, and dipsia is related to thirst. So that is excessive thirst. Hi, welcome back to our learning session. For today, our word is still related to DM, and that is Polyphagia. So Polyphagia, as compared with our past words for the past days, it's still increased or excessive hunger, right? So when, for example, in the case of diabetes, when you have when your stored energy or when your stored fats is being utilized, then as a compensatory mechanism, you are actually craving to eat a lot, right? So you term that as polyphagia, right? So that can be very common, and that explains why a person with DM usually has weight loss, because of the consumption of the stored energy or the stored fats.
Para sa ating HOTD or Hugot of the Day, Polyphagia or laging gutom, para bang ikaw na laging gutom sa atensyon ng pagmamahal ng crush mo na ikaw lang naman may gusto? Saklap, diba? Hi! Charet! Bye, Bavarians!
That is Polyphagia. Hi, welcome back to our learning session, and our word for today is hyperglycemia and hypoglycemia. So with my past videos, with our learning sessions, with our daily learning session, we said that if it's hyper, that's above the normal range, and if it's hypo, that's below the normal range. So normal blood glucose level is 80 to 120 milligrams or 80 to 140 milligrams per DL. That is the range. So a person having below 80 that's hypoglycemia. Usually, if you're hungry or your body already has below glucose level, and with regard to above, for those with consistent blood sugar increase, especially with DM or diabetes mellitus. Hi, welcome back to our learning session, and our word for today is Glycosurya. So when you hear about Glycosurya, so it's still related to your glucose. That is presence of glucose or sugar in your urine, right? So when your urine is being checked, then there is presence of sugar. So normally, the kidneys actually reabsorb our sugar, and it should not leak to our urine. But there is a specific threshold of the kidney that it can hold back the sugar. So that is 180 to 250 milligrams per DL. That's the renal threshold. But if it exceeds 250, normally it will leak out to your urine. So that's why when urine is being checked, that is having a glycosuria. And this is very consistent for those with high or